the needle is on the same side, right? And on the same meridian, okay? If the number of the needle is not enough to connect on the one side, for example, 3 or 5 or 7 or 9, you could have one thing alone. So we can connect 2 points on the same character of the meridian. For the example, the yin with the yin, the yang with the yang. So in some case, we can connect on the both sides, but have to show the principle that the yin meridian is the yin meridian.
Yeah.
So it can be same.
So you can do yang and yin on the same line?
On the theory, we should not connect the yin with the yang, but in practice, it's not problem. It's not a big problem. So, okay. And for the question that how about when we connect on the both sides and the feeling on the both point is not in the same level, it's not a big problem, because even when we connect 2 points on one side and on one meridian, it still have one point is stronger and one point is weaker. It's not a problem, because you know the electron line will come from the red line,
Yes. The plus pole to the
the red line parallel to angle. So it's always have the different 2 points. It always have the different level of stimulator. So it's not a big problem. We can adjust it. Not is not our priority. Not a big problem. So even when you connect 2 points on one side or 2 points on one meridian, you still have one is stronger and one is weaker. It's always. Never have the same stimulus on one line.
So this is the minus pole, right? And this is the plus pole. So the electrons go from the minus to the plus.
Yeah.
So you think about that when you put the. You like if you want to, for example, let's say I want to
Yeah.
on the spleen, and I want to tonify. I do the minus pole here and the plus pole here, or you don't care.
The direction of the electron should be not mostly, should be the same direction of the blood and qi in the meridian. When you want to improve the flow of the meridian, the direction of the electron should be the same way with the flow of the meridian. If you want to degree or stop the flow of the meridian, the direction of the electron will be opposite. If the meridian is come on this way, if you want to stop it, the direction of the electron should be on this way. But you want to improve or increase the flow of the meridian, the direction will come to this way.
That's interesting.
And you told us like the guy with who had another good dream that he was on the anticoagulant. Could we take them like things like this? So it's not needle.
Yeah.
Could also.
You know, so good idea. It's a good idea when you give that kind of acupuncture on this patient, because it's uninvasive.
Yeah.
It's uninvasive and not bleeding.
Yeah.
It's a good idea. One kind of patient that you should avoid is patient with pacemaker injury.
Peacemaker is forbidden for electronic.
Yeah.
But
You
also
can give
for
the
needle.
acupuncture, the traditional acupuncture without the electricity. Okay? It's safe. It's safe.
But with a pacemaker, no needle also? Or just not?
No electricity.
Yeah.
They give the needle but no electricity.
So you can do the needle.
Yeah.
And it's also a little defibrillator.
There defibrillation.
Also no.
ICD, no electricity. No. Not really, but just for sure. In some case, and I asked my professor, they still say that it's safe, but we should not try it.
No,
We
I
should
don't
not
want to.
try
I
it.
don't want to try this.
even with me, I'm also a specialist in emergency. I worked in intensive care unit and emergency department for 6 years. I do a lot of cases of the CPR, but we should not do it. Shouldn't try it. And if patient have the undergoing the cardiology operation in the history, we should be careful when this acupuncture becomes when we give acupuncture on the patient, simultaneously on the skin, cross our skin and go into our blood. So if patient have the, especially if patient have the artificial vein, we have to carefully wash our hand carefully, use the cotton every time, and in that case, we will not use the normal alcohol. We will use the polyvinyl, the solution of iron for sát khuẩn gì mày?
Clean.
Clean.
Disinfection.
Yeah, to prevent the infection. We will use the polyvinyl solution, not normal alcohol.
And do you treat not so strong, like little irregulations of the heart with acupuncture? Like if someone has like sometimes
Okay, I understand.
no, and how do you
With
treat?
that case, most the reason or problem is come from the man. So we can use the acupuncture to control the mental situation of the patient. So when we adjust the mental situation, the rim of the heart will become normal. We not affect directly to the heart, to the rim of the heart. The heartbeat will affect all the normal. So the recipe will be the same when you use the recipe with acupuncture for treatment the patient with undergoing stresses. The sleep loss,
So calm down and share.
yeah, come down the sensation. And hypertension, the first grade of hypertension, the recipe will be the same on that patient. Most of the patients have the sometimes it's rapid and sometimes slow, right? Rapid, sometimes rapid, sometimes slow, sometimes normal, but most of the time it's normal. We will see that kind of patient in female and young patients.
And when it's older people and it's just because of their oldness and they
Sometimes, but with older people, we have to carefully, we have to classification, and with the older people, we should give them to the hospital and take a higher examination. And if everything is okay, they will come to it and we will keep acupuncture for that patient.
and then also like the same like stress.
Yeah, the recipe is the same.
Okay.
But it will require patient to come to our clinic every day in about 1 to 3 months. So sometimes it will be complicated. And then do you know about the lift, thread lift acupuncture or cat lift and bending acupuncture?
The underneath. Yeah.
You lift the cat lift, the cat lift lift, the cat lift thread with it in our body, and it will stimulate our body every day, every time. It will more suitable for that kind of patient than traditional acupuncture, because patient don't have to come to our clinic every day. You can do it one time for 1 month, one time for 1 month. Minimum time is for 2 weeks, and the longest is for 1 month. So it, or
Do you use this point, stomach 9? Do you use it for hypertension as well?
no, because this area is very sensitive. I usually use the technique called is vessel massage to reduce the heartbeat. In some case, it can make our heart stop pumping. Especially in some patient, in some case, especially this patient, fat patient like me, when you take a cava, suddenly dead. Never touch.
They're dead? No.
Dead.
Just for sure.
Dead. Totally dead. So never touch on that area. You can touch the aortic here. It's popping here. So even when you give a massage, you should to avoid to touch our aortic. Vessel massage and eyes pressing can make our heart stop pumping for a moment. But in some case, it not recover.
So careful with this one. Okay. You don't use it.
No, never.
Also not for acupuncture.
Yeah, never give acupuncture for this area. It's very dangerous. Very dangerous. The vessel massage will very effective when I want to reduce the heartbeat in a pregnancy patient. With it's very helpful to reduce the heartbeat, but in some case it can make our heart stop suddenly and cannot recover. So never touch this area outside the hospital.
But massage is okay.
With carefully. Only touch the muscle. Only touch the muscle is okay. But you have to find the aortic and avoid it. Only touch the muscle in this area. But carefully. It's okay.
Is there, except the anticoagulant, is there any other blood disease or anything that's where we can't needle?
Most of patients have the blood disease. They all know about the condition because most of them are. Most of the kind of patients have that disease when they were born. So all of them know about the history manual, so they will tell you. But in case of patient taking the drug to prevent the thrombosis, you have to ask on another kind of blood disease. They will not come to you in your private clinic because they all know about the disease, and most of them cannot live normally for too long.
And if they have like a lack of blood platelets,
we will see that kind of patient is very old people or dengue fever. Dengue fever will prevent our body to burn a normal platelet. So dengue fever we cannot come to our private clinic.
yeah, but I have some patient who came to me with a lack of blood
You
platelets,
still can give acupuncture, but notice if you see the hemorrhage rash on the skin, you have to stop the acupuncture.
yeah, because every time like everyone touch or she has like blue spots.
Blue rash.
So I'm like, okay, is it maybe dangerous if I needle her? And so I said I don't want to take any risk, but maybe you should ask someone else or maybe go more
That kind of patient like your patient is very high risk. So my advice is we should avoid the patient. Because sometimes it can make an uncontrolled bleeding and the blood can fall out of your skin hole. So just for sure you should just massage.
What's the disease?
What the disease was.
They do not have enough the platelet, or the platelet have don't have function. The amount. The amount of platelet or the function of platelet is not completely. So they, if they have a bleed, they cannot establish the clot. So the blood still fell out.
It's a genetic.
Yes, it causes the genetic.
Yes.
Rút sót à?
Vâng ạ.
Cái gì?
Không, tức là mình tới em rút kim cho bạn, xong em xoa lưng cho bạn. Xong hôm nay bạn khác không giúp, bạn không xoa thôi, mà chỉ kể chuyện thôi.
Phải bàn giao. Any question? Did you practice about the hero acupuncture or another department?
On the what?
Hero acupuncture?
Hero.
Hydro acupuncture. It's
The hydro.
Hydro.
With the vitamin.
Yeah, vitamin.
Yeah, we heard it, like we saw it, but in Europe we're not allowed to make injections. So you're not?
I am.
In Germany? You can do it in Germany?
We are allowed.
But did you know about the contraindication? Contraindication.
Yeah, also people who bleed a lot, you should not use this because of the cholesterol thing. And also, I think with diabetes, with diabetes peripheral, no, what is it? With nerve, when they don't feel very good, or when they and we inject and they don't feel when there's something happening, we should avoid it.
But all of them are not the totally contraindication of hero acupuncture. The contraindication of hero, you have to make sure that the patient do not have any tumor inside body, cancer. Yeah. Because vitamin B12 will stimulate the improve of the tumor very, very quickly.
But how do we make sure, because the people don't scan like
You
randomly?
have to ask about the history. Yeah, there is something you can forget that your patient maybe has the cancer. One is weight loss. Weight loss more than 6 to 10 kilograms in 1 month will be the suggestion child cancer.
Another question. I know in Japanese acupuncture, I don't know if it's the case here, they sometimes with the needle make just blooding the body because they see like vessels and things like that to really get a free flow. Do you also do some blooding thing?
Yeah. With a patient with no problem. We will remove it. In case women uses for the patient, in case that they have a severe spinal muscle. Spinal muscle. Because when the muscle spinal too hard, too strong, it will increase the pressure inside the muscle. So when you cut out and take out the blood, it will reduce the pressure inside the muscle. And when you cut out the muscle, it will be a strong stimulator to help release the spinal muscle.
This is like, so you're kind of releasing the wind.
The wind and the back blood.
Oh, thank you so much.
Back side.
Kind. Thank you.
You can lay down on the back. Khác này có 3 máy mà mới có thêm cái máy tính nữa kia rồi không vào được á. Ok. là 08/08/2018.
The B12 injection is contraindicated when someone has tumors inside. Is there other things we have to?
It's a biggie. It's a biggie, and the most important thing we have to remember. Another thing that you told me is not a totally contradiction. It's just a concern. You just have to concern. One of the indication of the vitamin B12 is for sensory disturbance in patient with diabetes mellitus complication. You still need vitamin B12 to improve the sensation of patient. It's not a totally contradiction. Tumor is the biggest thing you have to remember.
Okay, yeah, we didn't learn that. Thank you.
And when you want to give the acupuncture for a patient and with the diagnosis of low back pain, you still have to check examination and check the patient very, very carefully with the low back pain, with the shoulder pain, shoulder and neck pain. You must give completely and carefully examination. Sometimes problem is not come from our spine. For example, patient like this, he have a pain for leg. If we not give carefully examination, we will say that you have a problem with your disc herniation, with your spinal, and it causes your lower pain, and it causes your leg pain, but the problem is come from the anterior. I have another case come from Germany. He's a Vietnamese and come from Germany, and then he come back to us with the lower back pain first, and then liệt vẫn gì nhỉ? Paralysis on two legs.
Completely
Not completely.
So it's a hernia?
Yeah. The first diagnosis is the disc herniation, and it affects to the nerve system and causes the pain and causes the paralysis. But he come to us for 1 week, and with every kind of treatment, it's not reflect. Everything still here, he's still pain, and paralysis is become more growth. And we have to remake our diagnosis, and we decide to take the X-ray film for the spinal and make the MRI film, and then he have a tuberculosis on the spinal.
Tuberculosis?
Yeah.
Yeah,
It's very rarely in your country,
Yeah.
right? It's very rarely, but in the tropical countries, very common.
But it's strange because if you have this herniation, you always get an X-ray, right? If you have a tuberculosis in the lung, the symptom is very clearly. But in another organ, it will be unspecific. Some patient. But he also had a disc hernia. He had both.
No, only in the
Okay,
spinal.
that's what I say. Like
Only in the
if you
spinal.
don't, if you don't,
Không biết một tí thôi.
think that someone has disc
Sometimes
hernia.
maybe he affect the tuberculosis bacteria in the past. In the past, he have the tuberculosis, but he don't know and do not have the symptoms until it's attack on the spinal. Some patients will have tuberculosis in the brain, in the small intestinal, and in the spine. And I also have another foreigner patient. He's English teacher in Vietnam. She has acute lower back pain after 2 hours teaching because that is COVID, so we all working from home. So he's sitting for 2 hours for a lesson, and then she stand up and she have severe lower back pain. So it's scary, and she come to my private clinic, and I do everything like normal. I take an examination and make a diagnosis and give her the acupuncture, the ultrasound therapy, and some kind of physical therapy. But after the treatment, nothing improved. She still feels very pain. The pain is become more worse. So I wondering why, and I decided to send her to hospital to make an MRI film. And you know what? There's a lot of tumor inside the body, and the tumor affect to the spinal, and she feel pain. The same symptom like this herniation, but it's not come from the damage on the spinal. It comes from the tube. Yeah. So very be careful if you give acupuncture, give the treatment, but the symptom is not improved. The pain is still there after your treatment. You have to 1 week. And in some cases it's normal, but if it is abnormal, you have to be careful because patient can become more worse, and especially if patient have the tumor, because if it's too big, it can drop out and patient can suddenly dead. The end stage is the end stage of cancer patient. The tumor will drop out and they will dead suddenly. So we don't want to have a dead patient in our clinic, right? So be careful if after 1 or 2 or 3 or 5 sessions and the symptoms still not improve, you have to remake your diagnosis. I also have another patient. He's an Indian IT and engineering, IT engineering. We have a shoulder pain, and my doctor. I also have a company, a private clinic, and my doctor do everything, and every symptom is still not improved after 1 week. So I said to my doctor that you have to reject this patient. I think that something wrong, something is not true about the diagnosis. So I sent him to the hospital and only take an X-ray film for the chest. And the tumor is inside the chest, his chest. So he fly to India immediately to solve the tumor. So you always have to make a question if your patient do not improve after 1 or some few sessions. I always have to remake our diagnosis.
And do you treat your patients in your private clinic every day as well?
No.
No, how often do you treat them?
Sometimes. Before COVID-19, I have a lot of patients and I have a lot of doctors in my company as well. But after COVID, I think not very difficult.
Why?
Because the economy has become too much problem. So people do not have a lot of money. So because you know, in Vietnam, everybody have the social insurance. The government pays for the medical fee. So most people have the care from our government for health problem. They only have to pay about 20% of medical fee. With older people, children, they don't have to pay anything when they come to hospital like our hospital. Yeah, older people and children.
I don't see in this hospital. I don't see a lot of people in like the middle age.
In the middle age, they have to pay about. They only have to pay about 200%. 200%. The fee when
Price.
Right. Price. For example, when you admit to our hospital and everything take you have everything take about $100. The older people and children don't have to pay anything. The middle people will have to pay about only $20. Everything is very cheap when you come to the hospital. So only rich people have to come to the private clinic. Okay.
But I mean, because in Switzerland usually you can't treat patients every day because it's also super expensive. So people come maximum once a week. Do you think that's less efficient, or is it just taking longer to see an effect?
For example, like patient in our department, the effect may come after 1 week. 1 week.
But treating every day.
Yeah, with everyday treatment. She's my high school teacher. She's high school teacher, and she have acute low back pain, and everything improved after only 3 sessions. Yeah.
But when we only see them once in a week.
Once a week. Once a week, I think you should to give the acupuncture, the massage, if the disease is acute, it can solve after only 1 session.
Yeah.
But if it's chronic, it can be hard to solve everything in 1 session. So I think that you maybe have, because you can do this for one week, or the cabin embedding. May be more reasonable. I think you should ask to study about the cabin embedding.
We're not allowed to do it.
Not allowed.
But do you sometimes give patients like I don't know, for example, some like exercises they can do at home, like qigong or like
Yes.
massage themselves? Do you use that?
I usually have to talk to my patient and teach them about the exercise to reduce or improve the disease. For example, the exercise for the neck, exercise for the lung, I can show you, or even exercise with the passy belt. It really helps. If the patient only can come to your clinic 1 time a week, so you have to tell them to do the exercise. Không có tư cho thần sinh thôi. Set yourself, feel the supervisor,